When can I drive after hip and knee replacement? That's a great question, and the real answer is it's individualized for each person. But let me give you some guidelines. When you operate on a leg, it certainly causes the muscles to be sore and swollen and perhaps not even work properly right away. That's why physical therapy is so important. So what I tell my patients when they consider driving after hip or knee replacement, I ask them to consider several things. One, can you walk steadily with minimal use of a cane? Now, it's okay to have a cane around. In fact, maybe you carry a cane longer than you need it just to keep other people away. But I need you to be able to walk steadily on both feet with minimal assistance of a cane. The second element is you got to make sure you're not taking pain medicine. So you should not drive a vehicle if you've taken narcotic pain medicine within 4 to 6 hours prior to that time. So, can you walk steady with a cane? Are you taking narcotics? Based on those questions, that should dictate when you can return driving a car after hip and knee replacement. Good luck. Be safe.